I'm by names of Dr. Ssentongo Saadick. I'm a doctor by profession, pursuing an MPH at University of Suffolk in UK, and I work with the AIDS Information Center in northeastern Uganda. Before I proceed, allow me first appreciate Dr. Stella, who is our director at CDC. This work was done under TASO, a project which later transitioned to the AIC project, which is aimed at reaching and sustaining the epidemic control in northeastern Uganda. And as shown there, those are my other co-authors, and the paper is titled Improving Viral Suppression and Attention Among Adolescent Girls and Young Women. So as stated in the morning, I will not repeat the UNAIDS statistics, but it's very clear, over 70% of the new HIV infections are among the adolescent girls and young women. And of course, when we looked at our data from Uganda, 70% of the new infections were in the age group of 10 to 24 years. And of course, that is as per the Uganda recent fact sheet, which is published by the Uganda AIDS Commission, which was also in line with UFIA, which is conducted by ICAP. And also according to the survey, which was done in 2016, it also reported a 17.2% maternal mortality among the HWs. In the morning, I know we talked about the triple threat, which is added onto this, because even from 2021 to 2022, there was an increase in the GBV cases in Uganda. So you realize that adolescent girls and young women, on top of having HIV, they have GBV, and also face other adverse effects that affect their health and their infants. So this is due to the unique needs and engagement of these adolescent and young girls in northern eastern Uganda, which pushes them to involve in these key behaviors like early sexual debut, the transgeneration sex. We all know the categories. When you do the analysis of the recent testing in some countries, you might find that the populations where you have so many young girls get infected in Uganda, you also have the big boys, the old men also having HIV. So they use that financial muscle to expose the young girls. And of course, involving the transaction sex and also having multiple sexual partners. And of course, for us to ensure that we overcome that, we need to design strategies and innovations that are able to tailor the needs and the requirements of the young girls. So in October 2020, with the support of CDC, of course, by that time I was still working with TASO, which we worked with on this paper, we had 83 AGWs. These were peers which are identified from 42 facilities across the 14 districts in northeastern Uganda. That is the Teso sub-region, the 10 and the 4 in Karamoja. And these AGYWs, the peers, underwent a 5-day training, and they are trained on HIV, gender-based violence, screening, and family planning services. So these young girls, the AGW peer leaders, were posted on these 42 facilities, where they were tasked with the screening the AGWs, and those who consented were recruited into the GNC approach. We all know that ANC, this is a program this is organized by different ministries, aimed at ensuring that the young girls or the pregnant women are able to receive the necessary services to have better outcomes of the pregnancy. And of course, you know, usually this one is, in some countries, it is generalized where they mix the old and the young together. So this approach looked at separating the AGW, since they have unique needs, assigning their peers that have delivered and have a negative baby, to be able to support them walk through this stage. And of course, we screened them. Those who agreed were grouped based on the age, the gestation age of the pregnancy, first trimester, second trimester, or third trimester, and their age, and they are offered the ANC services. The first engagement with the facility was through the individual management, but consequently they received services through the group ANC approach. You can see on the picture, this is one of the peers which was engaging the fellow AGYWs on the group-based discussions on HIV testing, adherence counseling, viral load monitoring, family planning services, and also ensuring that they are able to follow through with their appointments to ensure that those we have missed, they are able to return. Of course, we collected the data and we analyzed it in terms of frequencies and percentages to look at the contribution of having these children grouped in their age-specific gestation groups to receive the necessary services. The findings were astonishing because we are able to recruit over 46 For 46,566 pregnant and breastfeeding AGWs. And we noted during that engagement, we are able to have 477 that had HIV. And through this engagement, we are able to have 100% of those started on treatment. And even the retention at 3 months improved from 80% before the intervention to 98% during the intervention, with also the 12-month retention improved from 70 to 97. The viral suppression also across in these age groups was 97.5%, which was higher, improved from the 93% before the initiative. Additionally, also looked at those ones who are able, the breastfeeding, we are able to have the first PCR done in time. So in conclusion, the implementation of the group antenatal model significantly improved the retention for the AGYWs, the viral suppression, you have seen 97.5. The ANC attendances, because they would meet in their specific groups and have discussions on how best they can overcome the GBV, on how best they can be able to be supported to adhere. Those who had issues, specific issues of who within their groups would provide a private setting to offer specialized care. So this is what we had, and we realized they noted. So this contributed to the improvement of the care, and of course we analyzed this and we had to scale up the approach. So we acknowledge in summary PEPFAR, CDC, which provided this funding, Ministry of Health, TASO, our extended clients, and of course the acknowledgement. This work was supported by US President's PEPFAR through CDC, under the terms agreement, and the recommendation and conclusions are for the authors, not necessarily representing the official position of the funding agencies. Thank you very much.
Thank you, Saadick.